topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Good morning, Tennessee. Welcome to another Ask the Expert show. I'm your host, Steve-O. We've got two great shows for you today. Our first show is, I was kidding with him, not really kidding, but he has become a real celebrity on our show. I didn't want to tell him this, but we get so many letters during and after his show. People love this show. We knew it was going to be a hit because people were asking us, why don't we have an eye surgery show? And we finally had an opening. But one of the letters said, is Dr. Jones married? And that is the first time anyone has ever asked that. Let me welcome our expert from Wang Vision Institute, one of the top eye surgery institute in the state of Tennessee. Good morning, Dr. Jones.
Good morning, Steve. Thanks for having me again.
I got to tell you, people love the way you break things down. You make it, a lot of times you go to a doctor and they try to tell you what's going on with your health, and you're going, I don't understand half the words he's saying. And people really respect you for how you break things down. And we appreciate that so much, Dr. Jones.
Absolutely. That's my job. Doctor is, there's a Latin or Greek etiology of it, means to teach. It's a teacher. So as a doctor, one of my primary jobs is to teach my patients. And so I have to explain to them complex things about their eyes in ways they can understand. Yes. That's part of my job.
Well, you know what? We're getting so many new listeners. Lady just said, I just found your show. How long has it been running? I'm really excited to hear about, because we're going to be talking about cataracts today. And it's such an important topic because we have a much older audience, Dr. Jones.
Sure.
But first of all, tell us about Wang Vision Institute.
Yeah, so Wang Vision Institute is a practice here in Nashville, Tennessee, downtown Nashville, which focuses on, we do a lot of different things in our practice, but our main focus is on vision correction surgery. So we do laser cataract surgery. That's the most common surgery we do, but we also do vision correction surgery for younger patients, such as refractive lens exchange, Lasik, smile surgery, ICL surgery. All of the various vision correction procedures we perform at Wang Vision, and we're one of the leading centers for those particular surgeries. We see general eye exams and do comprehensive ophthalmology as well, but our main focus is vision correction surgery.
Well, we're going to be talking about cataract surgery today, and it seems, because we started promoting the show out a couple days before,
Sure.
A lot of people one of the questions is how do you know when it's time to go in and see a doctor, thinking maybe it's time for cataracts?
Yeah, that's a great question. That's a question I get every day. And cataracts are a reality of normal aging. As you get older, the natural lens of the eye starts to yellow, harden, get cloudy. And this is a universal aging process. When you examine the eyes of someone in their 80s or 90s, they always have cataract. So it's normal to develop cataract at a certain age. When we recommend surgery or doing something about the cataract is when it starts to affect your vision to the point where it's affecting your daily functioning. So some of the earliest symptoms of that cataract is getting to the point where it may be worthwhile to consider surgery would be trouble with night vision, trouble driving at night, seeing a lot of glare and halos around lights at night, making it difficult to drive. Some patients have difficulty with reading early on in cataract development. If you're having any of those problems, it's a good idea to have a consultation with an ophthalmologist just to see where your cataracts are at. Is surgery recommended at this stage? Can it wait? It's good if you're starting to have those symptoms. I would seek out medical advice to see if surgery would be worthwhile, because cataract surgery, let's face it, is the most common elective surgery that's performed in the world. It's performed millions of times a year around the world, and 3 million times a year in this country alone. So it is a very common surgery, very safe surgery as well, with a very good track record of success.
I gotta tell you, the first thing I noticed is one night I looked up at a star, Dr. Jones, and it like it multiplied. It looked
Yeah,
like there was 5 different points, and I noticed that at night. I really noticed it a lot at night,
sure.
with night vision.
Yes.
But, we're getting a lot of people saying, "What?" Because I probably waited 3 or 4 months to go in and have mine done. What happens if you wait and don't take care of the situation?
Um, yeah, sure. If you so when cataracts are very early in development, it's okay to wait if you aren't ready for surgery. There's no harm in waiting. We sometimes recommend to patients, if their cataracts look pretty early and mild and they're not super bothered by their vision, it's okay to wait another 6 months to a year, come back. We'll do another exam and see if the cataract has progressed to the point where surgery might be a good idea at that point. But you don't want to wait too long. You don't want to let your vision get really, really bad and really significant impairment due to cataract, because as cataract matures, as it develops in progression and severity, it becomes harder, literally more hard, almost like a rock, and it's very sometimes difficult to get it out of the eye. We have to use a lot of ultrasonic energy with our equipment to break up and emulsify the cataract. That can sometimes cause a lot of swelling in the cornea right after surgery, and it can prolong the healing process. So I don't recommend waiting too long, but if the cataract is still pretty early and your symptoms are really very mild, it is okay to wait some time for surgery, but I just wouldn't wait too long.
What about once you've had cataracts done, can they come back?
No, so once the crystalline lens, which is what cataract is, it's basically just clouding of that lens right behind your pupil. Once we emulsify it, it's gone. So we place a lens implant in that membrane that's left over from the old cataract, and that lens implant helps correct your vision after surgery so you can actually see. The cataract never grows back. Now, in a certain percent of patients, maybe 30 to 40%, they'll develop some cloudiness of that membrane, that capsule right behind the lens implant, and that can kind of blur the vision with time as that develops. That's very easy to take care of, though, with a laser procedure called the YAG laser, which we do in our clinic. It's very quick and easy, takes just a couple minutes. So that's the only aspect of the cataract returning, quote unquote. It's not really the cataract coming back. It's just during the healing process from the surgery, that capsule can get a little bit cloudy.
I don't know if you yourself actually get into this, but a lot of people wanted to know why I guess when you come back in for the second visit with cataract surgery, and why does insurance not cover that?
Yeah,
Why is a lot of people said it was an extra fee that insurance didn't cover.
sure, sure. So, there's different insurances, Medicare, private insurance. They all cover different surgical procedures and elective surgeries in different ways. In general, cataract surgery, when we're talking about removing a cataract and placing a lens implant, that's a medically necessary surgery for your quality of life and activities of daily living.
Yes.
We do bill your medical insurance for at least part of the surgery. We try to take advantage of as much of the benefits that you pay for through your insurance that we can for the surgery. Unfortunately, insurances do not cover laser with cataract surgery. They just pay for all metallic blade instruments for cataract surgery. They don't pay for laser cataract surgery at all.
Ah,
And then if you elect to get a premium lens of some type, such as an astigmatism correcting lens, called a toric lens, or one of these multifocal forever young lenses that give distance and up close vision without needing reading glasses, those have an extra charge out of pocket as well. Insurance will only cover what's called a basic monofocal lens, which is just a single distance lens implant, usually for distance vision, and you still have to wear glasses for everything else afterwards. So that's part of usually why there's extra out-of-pocket cost for cataract surgery in a lot of cases. But in my opinion, it's worth it. This is a one-time surgery. It's not like you're going to need the surgery every year for the rest of your
right.
life, and it's the opportunity to really correct your vision and improve your vision quality. And our vision's important. It's our, in my opinion, it's our most important way that we experience the world. And so I think it's worth the cost generally.
What about is there a laser cataract surgery
Laser
versus the
cataract surgery?
regular? Yeah,
Yeah. Yes. So
what is
laser,
the difference?
yeah. So that's a great question. So in the United States, not many cataract surgeries are actually done with laser. And again, that's generally because of the out-of-pocket cost for patients associated with it. Only about 5 to 10% of cataract surgeries in the United States are being done with laser. At Wang Vision Institute, for example, we were the very first practice in the state of Tennessee to start using laser with cataract surgery when it first came out about 10 to 12 years ago now. And now in our practice, we do 100% of our cataract surgeries with laser. Patients come to us specifically
Wow.
for laser cataract surgery because they know of our reputation as one of the leading laser centers in the area. Laser has a lot of advantages for cataract surgery. Bottom line is it increases the safety and the precision of the surgery. The laser, instead of having to make the incisions with metallic blade instruments, the laser can make the incisions for us. The laser can correct some astigmatism as well at the time of surgery. The laser opens up the cataract membrane in a perfectly circular, perfectly sized, perfectly round opening. And that's very, very important because we use a lot of premium lenses in our practice to get patients' vision as good as possible. And we want those lenses to be very well centered and not tilted at all. And that perfectly round, perfectly sized opening helps with that tremendously. The laser can break the cataract up into a few pieces as well. So we have to use less energy to emulsify these really hard cataracts, for example. And the vision recovery is a little bit faster on average because of that. So the laser does have some tangible benefits with the cataract surgery. Unfortunately, insurance usually is not going to pay for it at all. It's an out-of-pocket charge for patients.
Let's talk about the surgery itself. Is it painful or I didn't have any pain with mine
Yeah.
and I didn't have any side effects at all, but are there risk or side effects also?
Yes, that's a great question. So is the surgery painful? The answer is no, it's not painful at all. Numbing drops are placed on the eye, and that controls about 99% of any discomfort that might occur during the surgery. We do all of our cataract surgeries at our surgery center where we do have an anesthesia provider, a CRNA or anesthesiologist to give some sedation as well. So you're awake for the surgery, but you're nice and comfortable. It helps relax you. A lot of times it makes patients kind of not remember a lot about the surgery to begin with, which is nice. But during the surgery
Yeah.
itself, there's no pain. There's usually just maybe a water sensation over the eye and maybe very slight pressure at times. That's about the extent of what one can expect during the cataract surgery in terms of things you experience. And really, you're just looking at a bright light the whole time and just trying to stay as still as you can. And that's really all there is to it from the patient's perspective. Side effects from the surgery are usually pretty mild. There's a little bit of blurriness the first couple days that usually clears up usually within a week, sometimes 2 weeks, depending on how bad the cataract is. Some patients will see a little bit of glare or halos or a little twinkle around lights or little waviness or reflections when the light hits the eye a certain way. That's totally normal. Some patients may see the edge of the lens implant with a little shadow out on the side in their vision, kind of like a black crescent almost. That tends to get better with time. Those are kind of some of the biggest side effects per se of the surgery.
I got to tell you, it was such an easy surgery. Um, they told me I needed to have someone to drive me home, but I got to tell you, I could have driven
Yeah.
myself. It was
Yeah.
such an easy, and I got to tell you, Wang Institute is, and I'm in Florida, and they're in Tennessee, because I guarantee you, if I were in Tennessee, anywhere in Tennessee, I would have gone to Wang to have my LASIK and my cataracts done. You guys are so far ahead. I got to tell you, you probably won't admit this, but Wang is so far ahead of most ophthalmologists.
Yeah. Well, I thank you for saying that. We try to stay, a mantra of our practice is staying on the cutting edge of technology. So, like I said, we were the first in the state of Tennessee to start using laser with cataract surgery, and one of the first centers in the whole country, actually. We were one of the first to adopt laser, the first practice to do small incision LASIK in the state of Tennessee, and we're one of the leading centers in the country for that particular surgery. One of the first centers in the state of Tennessee, the first actually to use the trifocal lens implant at the time of lens replacement. So we have a history of being one of the first to adopt new technology as it comes out, and we become experts in this technology as time progresses. And patients come to us specifically because of that reputation and knowledge that we have as physicians.
And I got to tell you, we are so lucky to have you all on with us. We do a live show, and the show's become so important. We replay it throughout the month. One of the things, some of these things I know from going through cataracts, uh, but what we're doing is we're educating the audience out here. How long does the surgery take?
Yeah, that's a good question. So the surgery is pretty quick. The laser portion of the procedure takes like a minute or two, very quick and easy. The surgery itself, removal of the cataract and placement of the lens implant, on average, 10 minutes or so for most cataracts. So this is a very, very quick surgery. I tell most patients you'll be at our surgery center no more than like an hour or two usually,
Yes.
and get you ready, get the dilating drops in, do the surgery, which is really quick, bring you back to recovery, make sure everything's good, and you go home right after surgery. It's quite quick.
And are there any type of restrictions during the recovery period?
Yeah, there are some restrictions. Day of surgery, I recommend go home and try to take it easy. That's the most critical time when the incisions are still fresh, the lens implant is still kind of getting adjusted to the capsular bag that we placed it in. Day of surgery, try to take it easy. Try to do very minimal of anything day of surgery. Day after surgery, you can go back to doing most normal activities. I would The caveat would be usually I recommend for the first 2 weeks trying to avoid a lot of aggressive exercise, bending over or heavy lifting, any really significant exercise where you're going to be sweating a lot and sweat could get in the eyes. Try to avoid that for 2 weeks. No water in the eyes for 2 weeks. So showering is totally fine, but avoid pools, hot tubs, saunas, things like that with contaminated water sources. And then we just ask you to try to avoid rubbing the eyes or putting any pressure on the eye for the first week after surgery. Those are the basic restrictions. But in terms of driving, most patients are going to be okay. You can drive the next day if you feel comfortable. You can work on the computer if you feel comfortable and you're able to see well enough. You can be on your phone. All of that's fine day after surgery.
Here's Molly in Nashville. I am so glad there is a show like this. I had cataracts, and it's nice that you're educating people about this. My question is, will people still need glasses? And what are my options to reduce my dependency on glasses?
Yeah, that's a great question. At Weighing Vision, we do our best to make our patients as independent of glasses as we possibly can. So, a lot of times that does involve using special lens implants at the time of the cataract surgery to majority of the time it's to correct people's astigmatism so they can see very, very clearly for distance and may still need reading glasses after the surgery with that particular lens implant. Some patients come to us and they want to minimize their dependence on glasses as much as possible. And for those patients, a lot of times as long as they're a good candidate, based on our testing we do in clinic, we'll recommend the trifocal, multifocal forever young lens, which gives distance and up close vision. So yes, there are definitely lens implant options to help reduce your dependence on needing glasses after the surgery. In years past, 20 years ago, the goal of cataract surgery was really just to get the cataract out and just put some kind of
Right.
lens in there so the vision's at least mildly corrected. And the expectation was you would need to wear glasses full time for everything afterwards, progressive glasses for distance and up close in order to see clearly. Cataract surgery technology has evolved tremendously since then with laser and these premium lenses. And we can definitely, a lot of times, get patients very minimally dependent on glasses.
I got to tell listeners, if you are looking for a clinic, an ophthalmologist that is state of the art, sometimes way ahead of other clinics around the state, Wang Institute is your best bet. We've actually had a couple people call us that have had surgeries, different types of surgeries by Wang Institute, just recommended you so highly. Dr. Jones, are there any misconceptions about the laser cataract surgery?
Yeah, well, I mean, I think probably one of the biggest misconceptions about cataract surgery in general, which we kind of alluded to earlier, is that you have to wait to have cataract surgery until the cataract progresses to a certain point. And a lot of people just kind of suffer through their vision kind of slowly deteriorating with time. And that's one of the biggest misconceptions that I hear from people that I meet, outside of my practice in my daily life. They wonder, if they need to wait to have cataract surgery until it gets really, really bad. And my answer to that is, as I mentioned earlier, is no. It's a good idea to have a consultation at least with an eye surgeon or an ophthalmologist to figure out if it would be recommended to do cataract surgery. And we do cataract surgery all the time for patients who are maybe just the cataracts kind of in the earlier stages, but they're really bothered by their vision. They're struggling a lot and they want to improve it. Cataract surgery, the technology's evolved tremendously. And so we're able to do cataract surgery much earlier in the progression of cataracts and still get excellent outcomes for patients. And so that's one of the biggest misconceptions that I kind of encounter on a daily basis. Yeah.
Do you ever get where the vision of the patient changes after laser cataract surgery?
Mhm.
I mean, if that happens, what are their options then?
Yeah, that's a great question. So yes, I mean, vision can change after cataract surgery. The lens implants they're biocompatible and they're designed to be able to last the rest of your life. They're designed to be able to last decades and decades into the future with no problem. So the correction afforded by the lens implant that we place at the time of surgery is permanent. Now, vision can change with time due to some of the cloudiness of the capsule, like I mentioned earlier, where we do the YAG laser to clear up the vision. That's very common. That's probably the most common scenario where vision might get a little bit worse with time after cataract surgery, and it's pretty easy to address with the YAG laser. That's one thing. Sometimes vision does change astigmatism as patients get older into their 70s, 80s, 90s. Astigmatism on the cornea, that front part of the eye, can start to change in its magnitude with time. And when that occurs, sometimes it gets to the point where sometimes we do recommend patients start wearing glasses again. That's not super common, but sometimes it does get to that point. It's not super common that astigmatism changes dramatically with time, but that would be one of the most common scenarios as patients get into like their 80s and 90s and beyond, is that astigmatism changing.
Dr. Jones, your show goes by so fast. Tell people how they can reach Wang Vision Institute.
Yes, absolutely. So we have a website, www.wangvisioninstitute.com, that has tremendous valuable information about all the surgeries we provide and links to attend our webinar that we do every week where we discuss all these procedures in a little bit further detail. And there's links to book consultations in our office if you're interested. We have a phone number at 615-321-8881 as well, where you can speak to one of our staff if you have any additional questions or interested in scheduling a consultation.
Dr. Jones, you're such a superstar. Dr. Jones, you'll be back with us hopefully next month. Your show's on next month. You usually split time, but we'll see you next. Thank you so much for all the great information, Dr.
Absolutely. Thank you, Steve. Thanks for having me.
Thanks, Dr. Jones. That's Dr. Jones with Wang Institute. We're going to go to a break right now, and we come back. We've got more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.